Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Millicent Rovello, and I am here today with my amazing co-host, Dr. J. Calvert. How are you?
I am doing very well, and I'm very excited for today's topic because it's one that is near and dear to your heart.
It's true. Today we are talking about mommy makeovers. This is part of our 101 series, so it's a kind of brief overview of what goes into a mommy makeover. But I am very excited to talk about it because I've kind of been on a mommy makeover tear for the past month, and so it's fresh on my mind.
So is this a mommy makeover, or is this a makeover done by a mommy?
Yes and yes, all of the above, which is different than a daddy do-over.
That's right.
Which would be what you would do.
Well, and I've had to do some of those. I'm just saying. But yeah, I mean, the mommy makeover is key. I actually do mommy makeovers myself. We both do.
Of course.
Because
it's part of plastic surgery.
Yeah, it's the deal. I mean, come on. So what's for the 101 series that we are doing, Mommy Makeover 101, definition of a mommy makeover from your standpoint?
Mommy makeover is typically done for a mommy, so someone that's ideally completed their childbearing. They've had their 1, 2, 3, 4, 5 kids. They're not planning on having any more.
Settle down with that 5. Right?
You know,
let's hold it 4.
I had one who had 6 a few weeks ago. So sometimes there's numerous kids.
Yes.
But they've had X amount of children and they're done with childbearing. And now they are coming to reconstruct and rejuvenate all the damage that is done by those little adorable sucking piranhas that we call our children.
So kids, this is your fault.
Yes. And there's no set list of procedures that constitute a mommy makeover, but typically it involves doing something for the breasts. So that can be as simple as a breast lift. It can be a breast lift with implants. It can be implants alone. It can be breast lift with fat grafting, something to rejuvenate the breasts that have taken a beating with pregnancy and childbirth. And then typically something to rejuvenate the abdomen, which obviously also takes a beating with pregnancy and childbirth. And then there are some other things that can be thrown in, if it bothers them, liposuction of the legs, a labiaplasty, other things can be thrown into the mix, but typically it has a combination of procedures for the breast and the abdomen.
Yeah, that's how I think of it. It's, we're going to take care of the things that are typically, need a little perking up after the babies.
A little TLC for all of the hard work that they did.
For sure. And abdomen and breasts are the focus of a mommy makeover. The labiaplasty does kind of play in a lot of times because you're there. And
you're already there. You're looking right at it. The labia itself don't necessarily change much with pregnancy and childbirth, but they can. And sometimes when things get torn or sutured back together, they're not always done in the right way. Or maybe it's just one of those things where it's like, I'm already here doing all this work. Right. Why don't you fix this?
Well, with the 97% C-section rate in Newport Beach, that's a joke.
It's not. It's like 92%.
I'm just kidding. It's 95%. No, there's such a high C-section rate that
things don't get torn as much.
And that may be by design, but I think the OBGYNs just like to be super, super duper conservative. So like C-sections happen way more than natural vaginal births in sort of the population I see anyway.
Right. And it's just, it's the population we have. It's doctors who want better control of their schedule. It's patients who want control of their schedule. Like, I don't have time to go, am I having a baby right now or am I not? Like, September 12th, I'm going in, I'm having this baby. I can work up to September 11th. Like there's a control factor to it. But the C-sections themselves can also cause some problems.
Yes.
So that scar doesn't always heal well. You may have a little flap of skin that hangs over it. And so that's why patients will come in asking for a C-scar revision, but some section scar revision. But sometimes what they really need is a mini tummy tuck or a full-blown tummy tuck.
Definitely part of the mommy makeover. So let's say your patient comes in, it says on the schedule, mommy makeover. How do you approach that consultation?
So the first thing I get is a thorough history. How many children have you had? How long ago was the last child? We don't want to be doing surgery 3 months after they just gave birth and they're still breastfeeding and leaking milk everywhere.
That's no good.
Like all of that needs to be done. You need to be done having kids because you don't want to have all of